I am not issuing a public health order mandating masks in the schools at this time. This decision is due to the reality that not all options have been exhausted to prevent the danger before us. The schools and the parents have even greater power than the health department to protect the children and the community in this instance. They are also better positioned to enforce such action. Under Michigan's revised school code, public schools have a responsibility to provide for the safety and welfare of pupils while at school or a school-sponsored activity. The authority of schools was affirmed by the Michigan Board of Education earlier this week when they approved a resolution that supports allowing local school districts to make scientifically informed decisions about whether to mandate COVID-19 masks for all students, teachers, and visitors. To be clear, the Kent County Health Department has reviewed the science, and we agree with the conclusions of the CDC, the American Academy of Pediatrics, our local hospitals, our medical advisory work group, and the overwhelming body of peer-reviewed literature. The use of facial coverings in the school environment has been effective at significantly limiting COVID transmission. At this time, I am presenting the community with the highest recommendation possible that schools and the parents require adherence to the guidance of the CDC, the Michigan Department of Health and Human Services, and the Kent County Health Department. Above all, I expect that the children under the age of 12 who are not yet eligible for vaccine are protected through mask use and other proven prevention strategies. Concentrating unmasked and unvaccinated persons into classrooms is very concerning based on observations of what is happening in other parts of the country where the new school year has already begun. While my greatest concern on this matter is for the welfare of the children, please understand that if COVID transmission is accelerating in any part of our community, that transmission will inevitably spill over into other parts of the community. That could also result in the capacity of our hospitals and healthcare providers to deliver timely outstanding care to be stretched to the limit once again. We must work together to protect their ability to care for COVID patients, but also to provide their full array of essential medical services. They cannot do that if they are faced with the same problems as their counterparts in other parts of the country. Like everyone else, I want to see schools open for in-person instruction and other activities without interruption. Our very best chance for that to happen is if schools, parents, and children embrace the strategies that have been proven to be effective.